Do you have vitiligo which is stable, and are you looking to undergo melanocyte transplantation? And are you thinking how you can get best results in melanocyte transplantation? Hello, I am Dr. Sandeep Bhasin from Keval Medical Center. Today I'll be talking about how to get best results in melanocyte transplantation surgery. Vitiligo is a very common problem. Basically, we divide vitiligo into two parts, stable or unstable vitiligo. If it is unstable vitiligo, that is, it is increasing in size or number, the patches are increasing, we have to treat it medically and with phototherapy. On the other hand, if your vitiligo is stable, which I mean the patches are not increasing in size, the white patches are not increasing, no new patches coming, no new white patches coming in last 1 year, and if there's any injury, it heals normally with the normal pigmentation, normal color. There is no whitish discoloration after any injury. Then we can label it as a stable vitiligo. Now it's very important that if a vitiligo is unstable, that it is increasing in last 1 year, we should not undergo any surgery. If your vitiligo is stable by all these three criteria which I said, one, a white patches is not increasing, no new white patch, and number 3, the healing of any injury is with normal pigmentation, then we can think of any surgery for vitiligo. Now, out of the various surgeries that we do for vitiligo, like skin grafting, punch grafting, melanocyte transplantation is becoming very popular because of many reasons. It is cosmetically very appealing. It does not require a big donor area. It can give you best result because the color matching is excellent in melanocyte transplantation. We can't say the patient has undergone any surgery after melanocyte transplantation. Now here are some results of melanocyte transplantation surgery of some of our patients. What are the things to keep in mind to give you best results after melanocyte transplantation surgery? Let me tell you one by one. Number 1, make sure that your vitiligo is stable. I've already explained what is a stable vitiligo. If your patches are increasing or new patches incoming, do not undergo the surgery. Wait, stabilize it with medicines, with phototherapy. If you undergo any surgery, if the disease is not stable, you will not get good results. You will waste a lot of your money and time and may get very disappointed. I myself refuse many patients who come to me for vitiligo surgery if they are unstable. I clearly say no to them and I say wait, take medications, take phototherapy, take other treatments, first stabilize your vitiligo, then only go for surgery. Number 2, assuming that the vitiligo is stable, the results of melanocyte transplantation are dependent on the areas, like on non-acral areas, which I mean, what I mean by acral areas, they are like your lips, genitalia, fingertips, and the tips of your feet, or the peripheral areas. In these areas, the results are not typically good. I would say anywhere between 40 to 50% results. Now, leaving these areas, other areas like your arms, your chest, your abdomen, your face, your legs, the success rate is anywhere between 60 to 80%, depending on how this surgery is done. So the area is very important. Where are we treating it? Which area are we treating for this surgery? Non-acral areas give you better result. Acral areas do not give you that good results. So keep that in mind. Number 3, now when I am doing melanocyte transplantation, the first thing that we do is we always do CO2 fractional laser of this area. Here you can see a clipping where we are doing CO2 fractional area of an area which is about to undergo melanocyte transplantation. Now when we do a laser, there are two things that happen. We do not have to go very deep into dermabrasion. The healing of wound is better. the chances of the wound going deeper and healing being delayed are decreased, and because of that, the chances of infections are decreased and the take-up of melanin is better. So it's my observation, if the wounds do not get infected, they heal better, and the result that we get after melanocyte transplantation is better if they do not get infected. And for that, one of the things is we should be using lasers, and we should not be going very deep with our dermabrasion. Now another thing that we do not in all but most of our patients, we also take some of the grafts from the back of the head, the FUE. You can see here one of the clippings where we are taking the hair grafts from the back of the head by FUE. We'll be treating them into a special solution to extract FUE stem cells. So when we take the stem cells from your FUE derived hair follicles, now these stem cells accelerate our pigmentation, make the pigmentation darker and quicker compared if we use the melanin from the skin only. So we combine the melanin stem cells from the hair grafts and the melanin pigment from the skin. We combine the two together to get the better results. Another thing, the fourth thing that's very important is when we take the graft. Now here I'm showing a clipping. We are taking a graft from the donor area. The thinner the graft, the better the result in creating the melanin pigments. How thin we can take the graft will also improve the quality of our melanin pigments and the results that we get after melanocyte transplantation. Now, when we are doing this surgery, we often do big areas now, and this big area requires a proper general anesthesia, a proper surgery. Another thing is, in my cases, when we do melanocyte transplantation, we are also combining micro skin grafting. Now here I am showing you the micro skin graft which is being used for the vitiligo surgery along with melanocyte transplantation. I am showing you this test tube which has got melanin pigment at its base. You can see on the down in the tube, the lowest portion of the tube is a blackish or brownish color pigment, which is the melanin pigment, which is called the pearl of the melanin pigment. Now this is very important. The better the pearls we get, the better the result we get after the surgery. Now, after the surgery that we have done, proper dressing and everything, and here is a clipping where we are doing the dressing. It's very important that for at least 5 to 7 days we do not move much. We immobilize that area. We are not moving much. We are not traveling much. We are not talking too much, especially in the face area on which we have done surgery. We immobilize that area for 5 to 7 days. That really improves our results. Now certain areas like lips, genitalias, still we use special techniques. You can see here in the lip vitiligo how we use sutures. We tie the whole thing. We do the special dressing and cover the entire area so that we totally immobilize the lip to give you a good result, better results after melanocyte transplantation. If you still have any questions or doubts, you can ask in the comments below and our team will get back to you. We'll answer it and try to inform you or educate you that what is best for your problem. Thank you.